Hello, this is Dr. Lisbeth Alter. Do you take tranquilizers? So, the more common tranquilizers end in PAM, such as alprazolam, clonazepam. So, these are different medications amongst a category of medications known as benzodiazepines. This usually requires a visit to your doctor, and they're known as controlled substances. So they are closely monitored and registered because they can be abused. Now, most patients may take a benzodiazepine for a short time. The patients that come to my practice come seeking alternatives to benzodiazepines, especially if they come in for anxiety. Most of the time, they've been offered by either a doctor or a psychiatrist some sort of benzodiazepine. So, because of its reputation of addiction and 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 side effects, most patients want something different. So they come to the practice to know what other tools are available that are more natural, less addictive, and sometimes they're patients that have been on these medicines for a long time and are also seeking help. And sometimes when they've been on them for a long time, it's hard to stop them. Always, you should, if you are on a benzodiazepine, you should seek the advice of your doctor before coming off. There is a place for these medicines. In general, I don't prescribe them because I believe so strongly against them. But uh, there are some patients that, regardless of what natural tools they use, or therapy, or both, they still feel this overwhelming anxiety. And I think it's an important topic, especially now during the pandemic. So just be aware. Today is nationally, it's a benzodiazepine awareness day. So just know before you start any of these substances that there are natural um, supplements that you can use. They're not as effective as benzodiazepines. So once you take one of these pills, you feel calm right away. And sometimes with natural things, herbs and such, it takes a while longer to get to that level of relaxation and calm, but it is achievable. It's just everybody's different. And especially if you've never had a benzodiazepine before, you probably, your body will assimilate something natural maybe better than someone who's been on benzodiazepines for years. There are also some intravenous treatments such as NAD that help patients with addictions to benzodiazepines. So some of the natural products that help with anxiety are one of ours is called Calminex, which includes valerian root. So valerian root is one of um, the most popular herbs for anxiety, but I also use magnesium, L-theanine, and others, even CBD oil, especially if it's derived from indica as opposed to sativa. So there are many more tools. I'm just mentioning a few, but always educate yourself before starting a medication, especially when it is a controlled substance. Again, if your doctor advises you to take this, do not be afraid. Most doctors have good intentions when they prescribe these, and but it's always important to also be an educated consumer. So thank you and have a healthy day.